Why has the United States become the center of the pandemic? Could it be because of the healthy and governmental politics?
It's always a number of factors. Remember, the United States is a very, very large country, and it's got the diversity of a continent like Europe. You know, they are the size of other continents, and they have that diversity. And as even though it is the United States of America, it's a country like many large countries that it functions separately, has separate communities, separate administrations, separate ways. So what they are seeing is different outbreaks in different parts of the country. And if you looked at the epidemic curve in the United States, in different parts, they have very different kinds of outbreaks going on. So to generalize about why they have such a large outbreak would be wrong. When we just declared this a public health emergency of international concern, which is our highest level of alarm, that's telling the world there is something very serious that is a threat that not every country paid attention at that time. I think many countries thought it was somebody else's problem, or that perhaps the WHO was making a fuss about nothing.
Has something changed since Donald Trump formally notified the withdrawal from the organization?
Not for us. The United States has always been a fantastic partner. And as I mentioned before, the United States has produced some of the greatest public health experts and done some of the most important public health work. And that partnership has continued.
Every day we see thousands of new cases and new deaths. In which stage of the pandemic do we are?
So worldwide, we're in an intense and accelerating pandemic. You know, we have over 18 million cases, and over 700,000 people have died within just 6 months. And you can imagine, if that had been, say, plane crashes, I don't think there are enough planes in the world to crash to kill so many people in that period of time. Many countries are in what's called the accelerating phase. They are seeing a big rise in cases, and this is particularly the case in the United States of America, but also in several countries in South America, Brazil. I think your own country is seeing an acceleration. We're also seeing a very, very large outbreak in India.
In a recently past, the organization was very criticized because changes in decisions. What do you think about that?
Our advice has changed, this is correct, because this is a new virus. So as the information about the virus has emerged, we constantly work with big networks of all the experts in all the different areas, in healthcare, in laboratories, in virology, in all these things. And research experts read more than...
Bueno, hay un adelanto de la nota de